All right. So grapefruit juice increases toxicity of which of the following: atorvastatin, beta blockers, ethanol, carbamazepine. And yesterday I gave you two mnemonics. So what do they mean? What are they and what do they mean? You guys should talk now. You can unmute yourself and talk. It's a conversation, it's a discussion. Okay, I will leave it. Here's the next question. Drugs that can reduce renal blood flow: diuretics, beta blockers, vitamin B, lidocaine. Carbamazepine induces metabolism of doxycycline. I will not answer it, Dr. Mustafa. Carbamazepine induces metabolism of doxycycline, ethanol, acetaminophen, and nifedipine. How can I spend my time on a Sunday and come and give discussion and none of you will take out time to at least go through what was discussed and even be able to
Hello,
catch
Chief.
on a Sunday, like my off day?
Well done, sir.
Not encouraging.
I just joined about 3 minutes ago. I actually went through it, sir. The first question.
Okay.
Yes, sir.
But did you hear my question? Because I was asking, I talked about, I left, this was an assignment, like go home. Okay, I even gave you mnemonics. I said, okay, go back and check the meaning of this mnemonic so that you get acquainted to it, so that we can discuss it this time. If you guys prefer me, I'll just dump questions, give you the answer, go. If that's what you prefer, because I like teaching, but if students are not encouraging me, I leave it.
Sorry, Chief. I didn't hear the question, sir. I was grabbing something. I only saw the question. I didn't hear your question.
You're not the only one, so you can't bear this thing alone. There are many other candidates here that heard the question. So you are just learning. But if you actually went through the stuff, then you should be able to tell us the mnemonics that I discussed and then what it means, like to decode it. That's where it starts from, to talk about enzyme inducers and enzyme inhibitors. And that's what most of these questions here are talking about. So if you miss that one, it's a vital step. You can keep floating, if you miss it. So carbamazepine reduces metabolism of doxycycline, ethanol, acetaminophen, and nifedipine. I'll just skip questions on enzyme related stuff because there are many of them. You guys are not flowing. When you read it, you can talk to us about it again. And in case you don't know, pharmacology is one of the bedrocks of internal medicine. So you cannot say you're a physician without a tight pharmacology, because that's basically what you do. You are not like the surgeons that go in to operate. You use medications to handle whatever after making your diagnosis. The common causal agent for aseptic meningitis: adenoviruses, arboviruses, echoviruses, Coxsackie, and Rio. In actual sense, all the viruses can cause meningitis, but like the commonest one you talk about there is echovirus before even Coxsackie. And actually, both Coxsackie and echoviruses are enteroviruses. The site of action of thiazide diuretics is proximal convoluted tubule. TAL, distal tubule, collecting tubule, descending loop of Henle. Okay, so this image basically of the um, your nephron. Glomerulus, Bowman's capsule. What's the part labeled A? Each of them have something they, you know, something that goes on in terms of diuretics. It's usually something that happens in a lot of the different parts of the nephron. So, what's this part labeled A? You guys should answer now.
Chief,
Proximal communication
I
system.
can't see it on the whiteboard clearly. I can't see it on my screen.
You're not seeing the whiteboard. Someone say something. Okay, if you're not seeing the whiteboard, there's no need posting the question. And let me just leave, like doing the description. Let me just move ahead.
So I'm seeing the whiteboard.
How many people are seeing the whiteboard? Please. Let me even know. How many people are not seeing the whiteboard?
Yes, sir. I'm seeing it partially. I'm seeing that A and B.
There should you can if you put your two fingers, you can drag the screen. Don't select the object, just your screen. You can if you put your
Okay.
first put your phone in landscape mode, and
Okay.
secondly, with two fingers you can move those things around. Just
Okay.
like anything, any other app. This is a document.
Oh,
Like don't select the object so that you don't move the object.
all right.
Just the document itself. Don't select Dr. Ayokuni. So you've seen it now. This is normal nephron now, normal anatomy nephron.
Yes,
No.
I can see it now.
Okay, you guys should know what. Diuretic is at the early part of the distal tube. Kidneys can concentrate urine at a maximum osmolarity of the following. To see the whiteboard, have you clicked on show whiteboard? You have to look at your options, your app options. Go there, click on show whiteboard. Your whiteboard will now show up. Let's answer the question so that we can move. following are seronegative spondylar arthropathies, except psoriatic arthritis, Reiter syndrome, ankylosing spondylitis, arthropathy associated with IBD, Behçet's disease, Behçet's syndrome. We've talked about these things in relation to something here before. This is Reuters. This is Behçet's. I will ask question, you guys will not say anything. You think I'm asking the question for play. You don't know it's important. Okay. All right. The following are correctly matched with disease, except ankylosing spondylitis, matching with B27, type 1 or 2 DM, type 1 DM, Dr. 3 and Dr. 4, rheumatoid arthritis, Dr. 3, Graves, Dr. 3, all of the above. Dr. Adamu, don't move my screen, please. You have moved all the questions and removed them from their answers. Now we're going to share it in the group. Double work, please. Rheumatoid arthritis is Dr. 4, not Dr. 3. So the correct answer is option C. That's the odd man out. Every other option is correct. Beta cells of pancreas secretes which of these hormones? Pancreatic polypeptide, amylase, somatostatin, insulin. You destroyed the entire discussion. Of course, it's insulin. Apart from gastric antrum, gastrin is also produced in the kidneys, pancreas, liver, thyroid gland. So it's the pancreas. Normal coronary blood to the heart. a question is posted, you should be able to attempt it. Correct answer is 70 to 80 mils per minute of cardiac tissue. Point mutations cause all except sickle cell anemia, cystic fibrosis, DM, beta thalassemia. The answer is obvious now. Of course, it's diabetes mellitus. So the following is not a monogenic disorder: achondroplasia, skis, myotonic dystrophica, malignant hyperthermia. Schizophrenia is the answer. It's not a monogenic disorder. HLA and SLE is what? Alright, we're choosing B. Should we just explain this thing? Anyway, um, there are 3 letters in SLE. So it's Dr. 3. Diseases associated with triple repeat sequences include all except Friedreich ataxia, Fragile X, Huntington disease, Refsum disease. Refsum is the odd man out there. Diionization indicates inactivation of chromosome X, autosomes X and Y, Y. Of course, that's where the concept of bare body comes from. You can up if you're confused about it. Um, which of the following immunoglobulin has the longest half-life? Of course, it's IgG. Concerning proteomics, Hemorrhagic fever may be produced by all except previous question is all of the above. Chikungunya virus, yellow fever, dengue, Colorado tick fever. Chikungunya. That's the only one that doesn't cause hemorrhagic fever. Rift Valley fever belongs to which viral family? Rena, Bunya, Flavi, Philo. Is a Bunya viride. Prevention of viral hemorrhagic fevers include isolates, wear PPE, case notif, and contact tracing, ILTA, and OTA. Severe cases of cancer may be associated with all except respiratory failure, failure, circulatory failure, hepatic failure. Respiratory failure is the odd man out. not the primary thing that Lassa does. It can shut down the circulation, of course. The person is bleeding out. Which of the following is not transmitted by mosquitoes? Onchocerciasis, yellow fever, Rift Valley fever, West Nile, Western Ukraine. Onchocerciasis is not transmitted by mosquitoes. When you see questions of that nature, it's your opportunity to ask yourself what now causes onchocerciasis. But if I ask you guys now, you keep quiet, so I'll leave it. Identify the wrong match: mosquitoes and hantavirus, ticks and Crimean Congo, mastomis and Lassa fever, mosquitoes and Rift Valley fever. Mosquitoes don't cause hanta. Which of these is true? Lassa fever is treated with IV ribavirin. Psychiatric disorder is a complication of Lassa fever. Zidampine has shown great efficacy in CD1 mouse model of Lassa fever. All of the above, none of the above. It's all the above. You've not heard of ribavirin before. It's used for Lassa fever management. Concerning yellow fever, which is true, transmitted through the bite of infected Aedes. The virus belongs to genus Flavivirus. Can lead to severe liver disease with bleeding. All of the above, none of the above. Um, all of the above. Now that we're on the topic of hemorrhagic fevers, as you practice medicine, especially internal medicine, because you'll be the first point of call for this sort of cases, you have to be careful. Um, You're not going to run away from patients. You're not going to discard patients, but you must protect yourself. Be fully protected with your PPE when you're managing such cases. And anything you do, you go and wash your hands. Protect yourself. That's the main thing. So attempt the question concerning Ebola, which is false. Poor prognosis include age more than 45. ZMapp is an experimental drug used for treatment. Commonest cause of death is fluid loss, and it has 100% case fatality. Can get up to 90%. From ranges from 25 to depending on some factors, 25 to 90%, but like it's not 100%. But you can as well say it's almost 100%. At 90 is very high. But that's the maximum. Like it can be lower depending on some other factors. Indications for poor prognosis in Lassa fever. So all of them are indicators of poor prognosis. Concerning Ebola, which is false. Says here Ebola is a single-stranded DNA virus. Transmission is by direct contact with body fluids. Commonest cause of death from first symptom is due to low blood pressure. Breast milk of person after recovery carry the virus for several weeks to months. Okay, so the obvious one there, we've discussed this before. Cannot, even if you don't know anything, you should know which viruses are DNA viruses and then extrapolate from there. This should be the last question for the day.